Hello, good evening. My name is Dr. Trude Ufundu of Snowspirations Global Health Solutions. Thank you and welcome to our clinic this evening. Today, we're going to look at the possibility of still becoming a mother despite the unfortunate absence of your womb. So, unfortunately, there are some women that are not born with womb. It's rare that there are some women that have that kind of condition: no womb, no uterus, no vagina. And in that situation, our major focus will be on the ovaries. Remember that the most important reproductive part of a woman is actually the ovaries, because without the other reproductive parts, once you have your ovaries, we can harvest the eggs and we can use the eggs to get the woman pregnant, though a different woman, and the woman can still be a mother. So the question is it possible for a desiring mother who probably had this genetic predisposition of absence of the womb, or a woman that had hysterectomy? So hysterectomy is the surgical partial or complete removal of the womb. So there might be some conditions that will warrant some women to remove their womb just to save their life. One of the conditions might be cancer. So if you have cancer in any part of your body, in order to keep you alive, we have to remove that part completely. So if a woman has total hysterectomy, that means the womb completely was removed. And in course of removing the womb, there are some situations we also have to remove the ovaries. It's called oophorectomy. So a combination of hysterectomy and oophorectomy is removing the womb and the ovaries. Anytime we are removing more because we want to keep you alive. The biggest problem in cancer is the possibility of spreading to other parts of the body from the primary place it started. So there might be some women that probably had hysterectomy, and the question is, can I still be a mother? Guess what? Yes, you can. However, there are very tough decisions you have to make. There are very tough realities you have to face. There are principally three ways you can become a mother. The first one is still experimental: womb transplantation. So over time, because of advances in medical practice and medical technology, we've actually had 70 successful transfer, womb transplantation. So we can actually take a woman's womb, probably a woman that got involved in road traffic accident, but the womb was preserved. We can harvest that womb and we can transfer it to a woman who need a womb. Currently in the world, we have only 70 successful womb transplantation. Very encouraging. That's number one. That's the one that will involve the woman becoming pregnant despite the fact she doesn't have her own womb. It's still experimental, too early. There are still a lot of things we need to figure out, because the recipient, sometimes some recipient can actually also be alive. So there might be some women that might have completed their family, or they might just be women that are willing to give their womb. So we need to look at the adverse effect of donating your womb and the adverse effect of accepting a donor womb. So it's possible. We've had 70 successful womb transplants globally. So that's number one. Now, the other two methods will involve you doing something extra you. So I'm going to give you the scenario for the first one. The first option is surrogacy. So if a woman had hysterectomy only and the ovaries are still intact and we still have good results there, the woman can go for IVF, but this time around with a surrogate mother. So that's another option. So assuming you had cancer, and luckily by the time we diagnosed the cancer, we actually removed your eggs. So any woman that has cancer, one of the areas that cancer can attack is your reproductive cells, especially the sperm and the ovary. So we will normally go and remove all those eggs and keep it in the egg bank. So by the time you're done with treatment of cancer, it can be chemotherapy, it can be radiotherapy, or it can be surgery. Once we are sure you're in remission, we can revisit your eggs we stored in the egg bank. We can now use that egg and look for another woman who would have checked, who would have made sure it's okay medically, psychologically, and otherwise, health-wise and otherwise. So women that will go for surrogacy are mainly younger women. So three parties are involved in surrogacy. The two couples, so you and your partner, then the surrogate mother who will carry the baby. So if you still have your eggs intact and your partner has the sperm intact, good. We can take your egg, we can take your partner's sperm, we can join both of them together outside the body of the woman that will carry the baby to form an embryo. Once the embryo is formed, we'll transfer the embryo to the surrogate mother. This is number two. Number three, obviously, is adoption. So the fact you were not able to succeed in pregnancy is not the end of the world. You can still be a mother through the three avenues I mentioned. The last two is the one that can work now because of technology. Womb transfer, it's not yet cosmopolitan. It's only left for advanced countries. That's where you can have that possibility of going for womb transfer. Of course, it's very expensive. The three methods I mentioned is very expensive, but there is no amount of money you will spend on your babies that will be too much. So those are the three practical ways of achieving motherhood despite the absence of your womb. Very possible. Number one, we can transfer another woman's womb to your womb. Number two, you can go for surrogacy. Number three, you can go for adoption. These are practical three ways you can succeed in still becoming a mother. Now, thankfully, you can also go for blended family. So in blended family, you can actually try everything. So some women can try surrogacy. If you have the resources, you can go for double surrogacy, and thankfully the two surrogate mothers can have babies. Sometimes they can even have multiple pregnant, babies. So we've had a case of a woman that had two separate surrogates having twins. So suddenly 4 babies. So you can do that, then you can adopt. So if you already have a baby now, let's say before you had that removal of your womb through surgical process, which we call hysterectomy, you had one baby, one girl, one boy, but you want to add to your family. You can use the method we call blended family. Blended family means using all the available options of having a baby at the same time. So you can start your adoption process while you're also looking at surrogacy. There is absolutely nothing wrong with it. If your economy can power that, that's actually the best. So of all the three methods you can use to still become a mother, the first one, womb transplantation, is still a far-fetched method. The remaining two is your best bet: surrogacy and adoption. So if you have the capital, if you have the resources, meet with your fertility specialist. They can either set you up with a surrogacy agency, or if they offer surrogacy, you can work with them. Then adoption. Adoption is also a legal process. So depending on the country where you live, before you embark on all these things, please find out the legislation in your country. There are different surrogacy rules for different countries. There are different adoption rules for different countries. So don't make the mistake of going to a country to adopt a baby, and getting the baby to where you live will be difficult. So make sure you tidy up all the legal aspects. Very, very, very important. Okay? That's my quick presentation. It's straight to point, and I see COO is in the clinic. So please, if you have any questions, ask. This is a very important discussion point. So COO, I'm expecting a lot of questions from you. So feel free and ask your questions. Then the other people behind the scenes, it's time for questions. Immediately after this clinic, I'm going to repeat the clinic in Facebook. So join me in our Facebook clinic immediately. What can lead to a woman not having a womb? Two options. Unfortunately, there are some women that are born without womb. There's a particular medical syndrome we call it, but I'm not going to bother you guys about that. So unfortunately, some women can be born without vagina, without the cervix, and without the womb. So it can be congenital. So congenital are the things you came into this world with that develop from birth. Now, unfortunately, some women can have hysterectomy. Anything that damages the womb beyond repairs, beyond the ability for you to become pregnant. For example, cancer. Some fibroids can also lead to hysterectomy. So some women will not deal with their fibroids until their fibroid has completely obliterated the whole womb, putting your life in danger. So some fibroids can actually kill you. At that point, the only option remaining is to remove the fibroid. Some women can have endometriosis. Some women can have other conditions that might warrant us to remove the womb. Some women will optionally say, you know what, I'm done. Maybe they used to have a lot of discomfort and they can go for cosmetic removal of their womb, cosmetic hysterectomy. So these are the things that can lead to removal of your womb. So removing your womb can be partial or it can be total. And in removing your womb, sometimes we remove everything. If you've completed your family and we don't want to take chances, especially if it's cancer related, we're going to remove everything. We're going to remove your tubes. We're going to remove your ovaries. You're completely going to have complete removal of your reproductive system. Please keep asking your questions. We're probably going to spend 15 minutes so we can hit Facebook and get the clinic all sorted for the day. Do you know if any of the women with womb transplant have been pregnant? That's a research I have to do. You actually stole this line because when I reviewed the literature and I knew 70 successful womb transplantation happened, the next literature review I wanted to do is to track those 70 successful womb transplant to know if they succeeded in having babies. So that might be a topic for another time. So I'll definitely give a clinic to that effect. So but I can't tell you yes or no because I have not done my literature review on it. It would be nice to know that out of those 70, at least few became pregnant with some other person's womb. It would really be nice. Good morning. You have an issue. You were taking Doxinex before for high prolactin. It didn't work. Now you're taking bromocriptine. Now, it's not a trial and error. I can't tell you the one that will work for you because I'm not your doctor. Now, the two medications you mentioned are used for treating high prolactin. So if the one they gave you is not working, you go back to the doctor that recommended that, then they can review. Both of them are good. So depending on how your body responded, if your body is not responding in a favorable way, we can remove it and we can try another one. So go back to your provider, okay? I don't prescribe drugs. That's unethical. I can't override your doctor's drugs and I can't prescribe drugs to you over the internet. That's completely unethical. Okay, guys, keep asking your questions. Remember the event coming up on the 30th. So if you're 35 years and above and you're believing God for a baby and it's not forthcoming, you belong to a special group of women, advanced in maternal age. We have to put more efforts towards achieving pregnancy. This is why we decided to devote April to Advanced Maternal Age Summit. So if you have not registered, by the time we go to Facebook, quickly register because the slots are completely being filled up. Deadline is on Saturday. You have to attend all master classes. You have to attend all the clinics. You have to do everything you have to do because you don't know where the Messiah is going to come from. Keep asking your questions. Can a surrogate womb reject an embryo like sometimes happen? Correct. Anytime we are going for organ transplantation, rejection is a possibility. Now, to limit the possibility of rejection, there are so many heavy drugs we can use, corticosteroids, and so many very heavy drugs, which can mitigate the likelihood of rejection. So before we even begin to go for transplantation, it involves a lot of complex processes, one of which is what? Blood group mismatch. We have to make sure that whoever is the recipient, that the blood group is compatible with the donor. So everything has to be done at the molecular level because the possibility of rejection is there. So when an organ is rejected, it means that your body did not accept it. And it can be a very deadly emergency that can happen and you can die immediately. You can go into anaphylactic shock. So yes, I don't know if you're copying our guide this evening because these are advanced questions. My COO is in the spirit. Okay. We IVF surrogacy. Now it's rare, but it's a possibility. Okay. Now, there are so many things that happen on the micro level we can explain. Majority of the failed IVFs can actually be rejection. So possibility of rejection is there, but it's not a common thing that happens. So it's possible, but it's not common. Because remember, we would have checked a lot of things. would have made sure both of them are compatible, would have made sure the endometrium is good, would have fortified the whole IVF process with important hormones. Then when pregnancy happens, we'll support the pregnancy by giving progesterone and all that. But it's possible. It can be a factor. Okay, guys, keep asking your questions. If we have more, we can aim for 20. If we don't have, we can stop at 15. So do we have any other question? We have extra people in the clinic. We have about 6 people in the clinic. So if you have questions, please quickly ask. I'll provide you feedback before we go to Facebook. Okay. When you were taking Doxinex, you were walking the prolactin. Now it's coming low. The doctor said it's important to do surgery. Surgery of where? Now, this is the danger of going in little chunks about your medical report. Now, what I will tell you is this. Where are you located? In Tumba. You need a very highly experienced provider that will follow a one-way traffic. Now, there are some conditions that can lead to irretractable high prolactin level. When you have a tumor in the brain called prolactinoma, that can happen. I don't know if that's the surgery they're talking about, but the gold standard in handling high prolactin level is use of the medications you mentioned, especially bromocriptine. So piggyback to your provider, please. Follow all the instructions they give you there. Okay? All right, so it looks like we've come to the end of the clinic. If we don't have any other question, we can end the clinic so we can go to Facebook. So COO, if we're good, you can give me a signal so we can go. You live in UAE. UAE is advanced. Okay? Okay, the pituitary surgery, good. So you have prolactinoma. So if I take a history of you now, detailed history, you probably have very, very bad migraine headaches sometimes, right? The position, the place that prolactinoma is located, the place your pituitary gland is located can actually cause a lot of problems, headaches. Sometimes it can affect your side. So you need to piggyback. If they have to do whatever they have to do, they have to do whatever they want to do, especially if you want to become a mother. Thank God you're in UAE. So the medical practice in UAE is advanced. So discuss with your doctor and come up with options. Now, don't waste time in a particular method of trying to become a mother. Change plans. If plan A is not working, try plan B, try plan C until you succeed. Thank you for coming. I'll see you guys again on Saturday. Please join us in our Facebook page immediately and we continue the conversation. Thank you so much for coming. God bless you and bye-bye.